Hello, everybody. This is Gretchen Day, and I welcome you to the COVID-19 presentations in our breakout 1B. Today, we're going to hear from Krista Schaefer and Denise Dillard, patient and provider perspectives on COVID-19 testing and vaccination, facilitators and barriers. And then we'll hear from Ruby Freed and Laura Eichelberger on COVID-19 and remote and vaccine acceptance. Please put your name and email address into the chat if you would like to receive credits. And also, if you have any questions, type them in the box. I'll make sure that the presenters see them. And Denise, are you ready?
So good morning, everybody. I'm going to start off with some introductions here and apologize for the technical difficulties. So my name is Denise Dillard. My mother is Mary Mayak from King Island, Alaska, and then my father is non-native. They met at University of Alaska Fairbanks. So I was born in Fairbanks, raised in Anchorage. I am the Director of Research for South Central Foundation, and I have been with South Central Foundation for 21 years now. And let me have Krista introduce herself briefly.
All right, my name is Krista Schaefer, and I moved to Alaska and started working at South Central Foundation with Denise 5 years ago. I now live and work on the unceded lands of the Tanana people here in Fairbanks. And I acknowledge this so we can all reflect on the colonial practices still in existence across our lives and our work. And I'm honored to work for and help share this Indigenous-led health research with Denise.
So the SCF vision is a Native community that enjoys physical, mental, emotional, and spiritual wellness. And speaking of COVID, I think all of us have learned how kind of multidimensional wellness is, as we've all been impacted by the pandemic that we're talking about together. So this is an overview of what we are presenting on today. So we're going to look at facilitators and barriers to COVID testing. We're going to look at what customer owners told us about testing strategies and to understand attitudes among those who have not received the COVID vaccine. In terms of background, unfortunately, Alaska Native and American Indian people have a history with regards to epidemics or pandemics. I know that my grandparents met in an orphanage due to the Spanish flu pandemic. We also know that Alaska Native American Indian people are at increased risk for developing the severe disease that can happen with COVID and higher mortality. And so testing and vaccinations are critical in stemming the pandemic, but there really was not a lot of data about facilitators and barriers, which is where this study came in. And I will turn it over to Krista now.
For this project, there was two things we did. The first approach was using our medical records to pull information about the customer owners who use SCF as their primary care clinic, and then all of those getting COVID testing or vaccinations across ANMC. And the second part was to do surveys, not only with customer owners or patients, as others might know them, but also with providers. And that was the meat of the survey, and it was to elucidate factors that facilitated or created barriers for testing and vaccination. Some of our results. So a ton of tests were done, and you can see the count across time here for over a year from when COVID started to this March, the end of March. And so you can see the total number of tests, but also how many people that was associated with, because people could get tested as frequently as they wanted, and the positivity rate. So we had two spikes or peaks in testing. One was last summer and then around last Thanksgiving. For the surveys, we wanted to compare the SCF clinic population with those being tested to see if there was some demographics that we were missing in offering testing or having access to testing. So you can see in the columns, most of the percents are really similar, meaning that, you know, the same ages that are coming to the clinic for other health services came for testing. The one difference was in sex, so more women are showing up to be tested. And all the comorbid conditions that we pulled were very similar, so we don't present those. From the survey, customer owners, our patients in the left column, did not really identify any barriers. But when providers were asked of the perceived customer owner barriers, they offered some suggestions like the hours that were available for people to come in, or concerned about getting COVID when they came into the clinic, and transportation. And then everyone was asked about strategies, and patients had a lot of ideas and were very supportive of many different testing strategies. So that could be drive-through clinics, increased social distancing. A very interesting one was the mobile testing unit. People were in support of that. And while most were being done already, the mobile testing unit was a new strategy that had support from our customer owners. The survey also asked about vaccinations, and I wanted to let you all know we had almost 250 customer owners or patients respond, and 77% of them had already received the COVID vaccine. So the next set of results is all about those are all from those who had not yet. Sorry about the slide issue. It looks like some can see my slide deck and others can't. So of those who had not received the COVID vaccine, 55% said they would be likely to get vaccinated if they had more information about the safety and efficacy. And the reasoning behind getting a vaccine, which they hadn't yet, were to keep people safe. And those people could be families, communities, or themselves. And lastly, reasons for not wanting to get it, again, went to the first part, and it was they were concerned about the safety risks. They didn't really trust drug companies, and some didn't get vaccinated because they didn't think they were at risk of having serious side effects or a serious case of COVID. So in conclusion, despite the fragmented presentation, we hope we met the learning objectives for you to understand the perceived facilitators and barriers in testing, and to delineate the strategies that patients were very supportive of and what was already going on, and the attitudes among those who hadn't received the COVID vaccine yet. And overall, I think this study and our project really highlights a huge success in the pandemic response across the ANMC campus. It also maybe points us to opportunities to increase testing or increase the opportunities to be tested for COVID among men, and maybe points to new strategies to continually increase testing, and maybe more so now vaccinations. I want to thank you all for being here and wanting to dive into COVID-related presentations with the pertinence of it in our pandemic lives today. And I think we'll take questions at the end.